Okay, going live.
Good evening, everyone. Thank you so much for joining us. We have a flu shot reminder message for you. Next slide, please.
If you take a flu shot, you won't get sick.
If I give it to my family, then they could give it to other people and a bunch of people could get sick.
You get a lollipop after? I'm being really bossy to you because you have to do it.
Aren't we dealing with enough of COVID-19?
If Mom has the flu, she can't go to work and make money.
You have to suck it up and do it because it will only hurt for a second.
It only hurts a tiny hint.
They put superheroes in your arms to help you get better, sort of, you know?
1, 2, 3, boom, you're done. They do something to help the I don't know. You forget your flu shot. If you don't have it, well, something bad could happen. You have to go get your flu shot or else. Don't be scared, just get it and be brave.
I love watching that video. I've probably watched it 100 times now, and I hope everyone's being brave and going out there and getting your flu shots. My name is Jessica Shee. I'm the new communications director for SFHSS. I started back in March, right before shelter in place, lucky me. And during that time, I remember doing nightly online shopping, looking for all the scarce supplies because for some reason toilet paper was a scarcity and I didn't want to run out. And so I was doing midnight shopping, looking around and, you know, triangulating between Amazon and Walmart and Target. Luckily, we had some very forward-thinking leaders at SFHSS, and they realized that I was not alone. And there are many people going through certain, you know, anxiety, TP insecurity. And so we actually, in a very short span of time, started 24/7 EAP. Because we knew people aren't just having issues and they don't just need to talk to people between the hours of 9 to 5. And that's just one of the ways that SFHSS has been working behind the scenes to help you take care of your health during this unusual time. If you can go to the next slide, please. Thank you. So today is all about you and your health, and it's actually our last medical webinar, so thank you so much for joining us. I did want to share a few ground rules. You will be muted for the entire presentation, but you can still talk to us and you can still ask questions. So depending on whether you're joining via your mobile device or if you're joining via your computer, if you click on the screen, there's going to be a menu bar either at the top or the bottom. And on that menu bar, you're going to see a little question mark box. If you hit that box, you'll be able to send us questions, and we'll try to answer them as quickly as we can during the presentation, but we'll also save many of your questions, especially a lot of the commonly asked questions. We're going to save it for our Q&A session at the very, very end. And if we don't get to your questions, we will get them answered online at sfhss.org/OE2021. And I apologize, it's supposed to be a dash FAQ. That's where all of the FAQs will be. If you go to the next slide, please. Thank you. So today's agenda, we're going to start with Mitchell Griggs. He's going to share what's new with SFHSS. Then Carrie Bashirs is going to share what's going on with the well-being programs. And Adam Gunther is going to talk about our 2 Blue Shield of California plans. And Gabriela Lurena will be talking about our Kaiser Permanente plan. And finally, Iris Schaeffer will be sharing our United Healthcare plan. And all of our health plan providers also offer office hours just for our members, and we'll tell you how you can access those office hours. If you actually received our email earlier today, there is a direct link to sign up for office hours. Thank you. Next slide. Oh, next slide, please. Thank you. And now Mitchell Griggs, our Chief Operating Officer, is going to talk to you about our open enrollment updates.
Good evening. I'm Mitchell Griggs, the Chief Operating Officer here at the Health Service System, and I wanted to go over a few things before we get into what's new with our medical plans. Just want to remind everyone that HSS has a robust member services support. One big tool, the great first stop, is at sfhss.org. That's our website. A lot of information you might want to find on there, or you can find on there. Also, we have telephone customer service center, and where we can answer questions about your eligibility and enrollment. Between the website and our benefits analysts that answer your questions on the phone, we can help you navigate and access your benefits. Right now, due to COVID, our offices are closed, so we don't provide any face-to-face member services counseling, but our office hours are open for telephone Monday, Tuesday, Wednesday, and Friday from 9 a.m. to 12 p.m. and 1 p.m. to 5 p.m. And then on Thursdays from 10 a.m. to 12 p.m. and 1 p.m. to 5 p.m. Next slide. It's open enrollment. That's why we're out here. The topic that we're discussing, I wanted to also draw attention to our website again. We have done some really great work. We're always trying to improve our website, and we've done some really great work on our particular open enrollment page, so please do check it out. Everyone received in the mail these open enrollment booklets here. You see the blue, red, light blue, and green, depending on your employer. Really good information there, everything that you need to know about open enrollment. It also contains step-by-step instructions on the front page of your booklet. This will help guide you through the thinking process, the decision-making process, and then how to change your benefits. The big benefit guides, often, sometimes when you come into our office, you can pick up one of the year's benefit guides. We did not print those this year. They are digital, electronic on our website on the open enrollment page. We will have hard copies by the end of the year. So if you would like one of those, you can contact our office or go to our website and request that we mail you one once we get them in our office. Just want to remind everyone to please use e-benefits. There's information in your benefit materials, also on the open enrollment page, how to register for account or reset your password. However, if you do not want to do it electronically and you'd like to use a paper form, those are available on our website. You would just need to mail it by the U.S. mail, drop it off at our office on the first floor next to the security desk. There's a red bin there for you to put that in there, or you can fax it to us. Next slide. Just a little bit about what's new for the 2021 plan year. Make sure you look at your open enrollment materials, check out our open enrollment webpage so that you can see how the rates have changed this year. Rates are just slightly different based on what union you belong to and what job type you may have. I wanted to make sure that everyone knows that beginning January 1st, your vision plan, either your basic or premier, if you enrolled in medical, you're going to get at least basic. VSP will be sending out ID cards. This is the first time that we've ever had a member ID that's separate from your Social Security number for the vision plan, and they will have that on a card that they will mail out. Delta Dental plans now cover nitrous oxide gas and other non-IV sedation. There's some other things that's new with the medical plans, which they'll be going over in just a little bit. But as far as flexible spending accounts are concerned, this year for 2021, you can enroll in FSA healthcare for a maximum up to $2,750. That's $2,750. That's a $50 increase from last year. And if you have any money remaining in your current 2020 healthcare flexible spending account, you can take up to $550 of those dollars and carry it over to the following year. And if you just want to use that amount, whatever you carry over, you don't have to re-enroll in an FSA. But if you want more than just what you're rolling over, you will have to enroll and make that election. Also this year, due to the CARES Act, there's new things that are covered under the flexible spending account that don't necessarily need a letter from the doctor saying that it's medically necessary, and that's all the over-the-counter things. So it's 2020 right now, and if you've had problems spending down your healthcare FSA, you can always purchase items over the counter, like your cold medicines, your allergy medicines, whatever, and they can be covered under your flexible spending account. You can also go to the FAstore.com and purchase things that will also be covered, over-the-counter type things that you can pay with your FSA. If you want to know more about FSAs, we have a bunch of frequently asked questions. We've had a couple of webinars earlier in the month that specifically addressed FSAs. Go to our open enrollment page, and all of those webinars are recorded, and those frequently asked questions are there for you to view too. Same with voluntary benefits. We had a couple of webinars earlier this month about these voluntary benefits, like this critical illness, pet insurance, credit monitoring type of benefits. And this year we had a couple of new ones. One of them is a MetLife critical illness, and then a MetLife accident insurance, as well as a new identity theft protection, and that's with Allstate. That particular identity theft protection we wanted this year because it also provides social media monitoring for you. And if by chance you need to make payments online for your employee benefits, your employee portion of the premium, sometimes you may go on a leave of absence and you could go through a period of being unpaid. You can make payments directly to our website, and that is in our payment portal, and you can find that more information about that on our website and how to make a payment. A great resource for everyone, and I encourage everyone to do this, and that's to sign up for our e-news. You can do that also at the bottom of our opening page on our website. We put a lot of work into that. We have a message from the executive director every month, and then everything new, additional information we need to know about your benefits throughout the year. This is an electronic newsletter that's emailed to you based on the email that you give us if you sign up for it, and it comes out right around the 5th working day of the month. Okay, next page.
Thank you, Mitchell. And now I'd like to introduce the manager, Carrie Bashirs.
Hi, good evening, everybody. Carrie Bashirs, WellBeing Manager with SFHSS. I'd like to just spend a few minutes going over a couple of different mental health and well-being resources that you have available to you. So as Jessica alluded to, as she opened us up this evening with this session, we have been able to expand our EAP services to 24/7. So it's been really excited that we have the ability to do that, to be able to give access to people to call at any time whenever you need it. You know, these are the times now where we're all enduring a lot of stress, possible anxiety, uncertainty, and so EAP is here for you. So please do not hesitate to call. When you call, you will be directly connected with a behavioral health specialist that will help you connect you to a therapist that fits best for you. Also, we've been able to continue to provide some services for the workplace, what we call organizational services. These are things like management, consultations, workshops, and trainings. Our internal EAP team continues to provide critical incident response and debriefings, mediation, and de-escalation training. So these are all things that if within the workplace you feel would be beneficial, please do not hesitate to reach out to them. They can still provide these services, even virtual, if you are in a telecommute environment. And then we also have a couple of online resources I wanted to highlight. The first is a web page that we dedicated for Mental Health Awareness Month back in May called We're Here For You. And there's a number of different great resources that you can check out. In addition to a COVID-19 wellbeing resource page that covers everything from parenting to resiliency to physical activity and health, healthy eating, kind of in this space where we're at with COVID right now. And then an additional resource we're really excited that we're very close to launching is a web platform called Credible Mind. Collectively, it gathers a lot of resources out there for mental health and well-being, and allows you to pick and choose the type of resource that best resonates with your learning style or how you like to learn more information. So for instance, if you are interested in learning more about anxiety, you can go on, search anxiety and find blogs or articles or books and choose what's best for you. Next slide. We continue to offer a lot of well-being services as well. A lot of these we did bring in person, but now that we're in shelter in place, we are moving or have moved, to a virtual platform. So we continue to offer health education webinars, group exercise classes. We recently launched our first virtual diabetes prevention program and healthy weight program. These two programs are currently closed. However, we will be offering new sessions in the beginning of next year. So please be on the lookout. Flu clinics. We are still, in flu clinic season here. So we have a number of different worksite locations where our clinics are open up to all of our members. There is still availability. So if you have not gotten your flu vaccine and you're interested in attending one at a worksite location, please again check out our website and you can schedule an appointment. You also can work through your health plan, your healthcare provider to get your flu vaccine if that's more convenient for you. There's also some additional online resources specifically around financial well-being. If you live or work in San Francisco, Smart Money Coaching is a free financial coaching program that is available for you. So again, you can find out more information on our website. And then Set Up and Go is really focused around ergonomics and movement. We have folks going into work, we have folks that are working from a telecommute environment, and so our landscape today is very different and what that looks like. So those resources help to provide some tools on how to set up your desk, and then ideas on how you can get up and move throughout your day to be physically active so you're just not sedentary the whole time. Next slide. Next, I'm really excited to announce a 4-week challenge that actually we just started registration today called Work of Art. It is our first challenge that we've done this year, bringing it to a perfect timing where it really focuses on mindfulness, gratitude, optimism, and connection. So we'd love for you to participate. You can go to our website, click on the link and register. The challenge starts November 9th and runs through December 6th. And again, really helps you to practice activities that can enhance your resiliency and boost your happiness. Next slide. So for more information, you can visit sfhss.org/WELL-BEING. And I'll turn it back over to you, Jessica.
Thank you so much, Carrie. And now I'd like to introduce Adam Gunther, the Account Services Representative from Blue Shield of California.
Thanks, Jessica. Hi, everyone. Like Jessica said, my name is Adam Gunther, and I am the Blue Shield rep who supports SFHSS and their members. Next slide. In the next couple of slides, I'll be discussing the 2 BSD plans offered to SFHSS members, which are the TRIO and the Access Plus. The TRIO and Access Plus plans have the same medical and pharmacy benefits at the same member copay. However, there are differences between the 2 plan options. The 2 main differences are member monthly premiums and the network. The TRIO plan has a lower monthly cost to you as the member, but it has a slightly smaller network. Both plans allow members to self-refer to specialists within your medical group. Both offer urgent and emergent care while traveling both within and outside the U.S. Both offer teledoc to access virtual consultations for medical and mental health, as well as our WellVolution program to all SFHSS Blue Shield members 18 years of age and older. Next slide. Some programs are offered only to TRIO members, and those include enhanced customer service with Shield Concierge. The Shield Concierge team includes experienced health advocates or registered nurses, health coaches, and social workers, all co-located with pharmacists, pharmacy technicians, and has a team of dedicated customer service representatives all committed to serving you. LifeSpring, a free meal delivery service, and Call the Car, a non-emergent transportation service, are also offered to TRIO members. If you're a TRIO member, you can check to see if you're eligible for these programs by calling Shield Concierge and asking to speak to a Blue Shield case manager. Also offered on the TRIO is Heal, an on-demand service where a doctor will come to your home, office, or hotel room at a time that's convenient for you, and access to healthier foods at a reduced price through health savings. Next slide. Now I'd like to talk to you about Teladoc. Teladoc is a great service offered to SFHSS Blue Shield members at no additional cost. Next slide. Let's say you're at home on a Saturday and you're not feeling well, you can't go to your doctor, and you don't want to go to the emergency room. You can request a Teladoc consult using your computer by going to blueshieldca.com/Teladoc or via the Blue Shield app on your smartphone. If neither of those options are available, you can also request a consult by calling their 800 number. During your consultation, you will be talking to a board-certified doctor who will review your symptoms with you, provide recommendations for treatment, and will call in a prescription for you if one's needed. Again, this benefit is at no cost to you as the member and is available 24 hours a day, 7 days a week. Next slide. Another option in the Teladoc program, which is new to SFHSS Blue Shield members in 2021, is access to the mental health professionals. If your consultation is for mental health, you'll be talking to a licensed psychiatrist who can prescribe certain medications, a psychologist, therapist, or a counselor who are available 7 days a week from 7 a.m. to 7 p.m. or 9 p.m. These professionals can treat mental health conditions including anxiety, ADHD, depression, grief, stress, and much more. Again, this benefit is at no cost to you as a member. Now, just want to reiterate, the Teladoc medical benefit is available 24 hours a day, 7 days a week. The mental health portion of Teladoc is available 7 days a week, 7 a.m. to 9 p.m. Next slide. Finally, I'd like to talk to you about WellVolution, which is available to all SFHSS Blue Shield members 18 years or older at no additional cost. Next slide. WellVolution is Blue Shield's digital healthcare benefit available to BSC members 18 years or older. WellVolution offers digital health coaching, exercise and nutrition advice, digital tools like weight scales and Fitbits to members who have a health risk. WellVolution also offers general well-being to help you remain healthy if you don't have a health risk or chronic condition. Next slide. To access WellVolution, you can go to www.wellvolution.com and register. You'll go through a health risk assessment questionnaire for WellVolution to get better acquainted with you, and then you'll be provided with apps and programs that best fit your profile based on the answers you provided to those questions. Next slide. For more information on these or any other benefits or programs offered to SFHSS members by Blue Shield, you can go to the microsite Blue Shield created specifically for SFHSS members at blueshieldca.com SFHSS. And also available on this microsite is our office hours that we're available to talk to you for one-on-one consultations. All you have to do is click on the link and you can schedule a one-on-one consultation and we will call you at a time that's convenient for you. Thank you.
Thank you, Adam. And we have a few questions for you in the Q&A queue if you're able to access that. And thank you for sharing.
Thank you.
Perfect, thank you. And now I'd like to introduce Gabriela Urena, the engagement specialist at Kaiser Permanente.
Hi, everyone, and thank you, Jessica. Can you guys hear me okay?
You sound good.
All right, thank you. Well, welcome. And as she mentioned, again, my name is Gabriella. I'm the Kaiser Permanente representative. Now, there were no changes from your Kaiser Permanente plan from 2020 to 2021. So I'm going to take this time to share some quick yet valuable information regarding your Kaiser Permanente care options, as well as the wellness resources that are included within your membership. Next slide. Thank you. So first, let me begin by explaining a little bit more about Kaiser Permanente's unique healthcare delivery system. We combine care and coverage so that our members can easily get the care they need to stay healthy. Within our facilities, you will find that we have everything from primary care, specialty care, lab, radiology, pharmacies, and more. And it's all under one roof typically. We also use an electronic medical record system so that every time that you get care with us, each nurse, physician, and pharmacist and doctor all are aware of your health situations and are able to continue providing you personalized care that you need. You also have access to your health record information through your electronic medical record and are able to connect with your Kaiser Permanente team because of that as well. Now, at any of our facilities that you visit, whether it's in California or the other states that we serve, you're still able to access your medical health record and get the care that you need. Next slide, please. Now, you have many ways to get care thanks to technology. You can get an appointment in person, but you also have the option to opt in for a phone appointment or a video appointment as well. You could also get advice 24/7 over the phone or online, and email your doctor's office with a non-urgent question and typically get a response within 2 business days, if not sooner. And what's great about all of these telehealth resources is that they are available at no cost to you and really allow you to save time and money in your day. Now, you can also schedule and cancel routine appointments online, refill most prescriptions, check most lab results and appointment histories, as well as manage your bills through your kp.org account. I highly recommend downloading the Kaiser Permanente app so that no matter where you are, you have access to your Kaiser team and making appointments as well as checking your history. Next slide, please. Now, overall, we're here to be a resource for you, and at kp.org/coronavirus, we offer frequent updates regarding the virus, how to prevent it, and what to do if you have symptoms or other concerns. You'll also find links to begin an e-visit, to speak with the nurse for guidance, or even schedule a test, and links to connect to the pharmacy to participate in mail order prescription refill. Again, to learn more, visit kp.org/coronavirus. Next slide. Thank you. Now, I think we're all aware that everything has been quite challenging this year for everyone in many different ways. And that's why I really wanted to highlight and give you guys a friendly reminder that through your Kaiser Permanente plan, you have access to mental health services. We provide both clinical and supportive services for a wide range of conditions, including anxiety, stress, depression, substance use disorder, and autism spectrum disorders. Our team consists of psychiatrists, psychologists, as well as marriage and family therapists, addiction medicine physicians, and medical social workers. As a member, you don't have to get a referral to make a mental health appointment. Typically, you have different ways that you can access your mental health care within Kaiser Permanente, but the first appointment can be scheduled directly through your primary care physician. You can just call the advice appoint line to just schedule an appointment. And if for the other sources of how you might be able to schedule it, feel free to visit kp.org/mental health. Next slide. Now, in addition to providing care to our members when they are not well, we also want to provide them with the support they need in order to maintain or improve their health with wellness resources like ClassPass, self-care apps, wellness coaching by phone, online wellness tools, and health education classes. Members also have access to reduced rates on specialty care services like acupuncture, chiropractic care, and massage therapy through a program known as Choose Healthy program. This program also provides wellness offerings like home gym equipment and wearable devices. Next slide, please. Now, some of the newer wellness offerings that we've been offering to our members this year includes ClassPass, the Calm app, and the My Strength app. You can take advantage of these membership perks to help you stay both physically and mentally fit. And what's great about them is that most of these services are no cost, and only one of them has a little portion that's low cost. So I'll explain that in a second. With ClassPass, you get at-home workouts, which includes fitness classes at reduced. So this is the part where you actually have reduced rates. You're offered fitness classes at reduced rates with live stream and in-person fitness classes like yoga, boxing, strength training from top fitness studios, and other options as well. And then what's included at no cost with this free membership is 4,000 and more on-demand workout classes that could include yoga, cardio, strength training, dance, abs, and so on and so forth. So you really have a lot of different options when it comes to making sure you have a fitness style that works with your schedule. You also have the option of using Calm to improve your mood, your sleep, and even your relationships. And both of the apps are, again, available at no cost. So Calm is the #1 app for meditation and sleep, and it's designed to help lower stress, reduce anxiety, and improve your sleep with soothing bedtime tales, music, and guided meditation. Now, My Strength is our final self-care digital app that we've been offering, and it offers more of a daily destination for improving and maintaining overall well-being and resilience. So it's a little bit more tailored towards mental health and getting to know yourself better in your mind and what maybe the little things that you're challenged with. So it's highly interactive, and it provides individual tailored applications to address depression, anxiety, chronic pain, and a few other topics as well. But with all of these resources, you're able to really work on your own well-being and your own resilience, and know that we're just here to support you both in your mind, body, and spirit. Next slide, please. So now that we've reviewed how to get care, your member resources, let's quickly review the new locations in Northern California. So for the locations that are scheduled to open soon, we have the Alameda Medical Office expansion and the Care Essentials in downtown San Francisco. I really wanted to highlight the Care Essentials in downtown San Francisco because it's scheduled to open in early 2021, and it was specifically built to offer a more convenient option and location for all of our members in the financial district that either work there or they find themselves commuting in and out of it, depending where you're coming from, where you're going. So this location is great for the commuters, and it's really there for quick primary care appointments, routine checkups, and prescription purposes on the way home. In addition, we have some new mental health and wellness centers that have just opened up in Oakland, San Francisco, and other areas as well. But these we've built specifically to address a member feedback where there's been a nationwide mental health shortage across the board. So we wanted to offer more locations, but also you'll realize that these locations are a little bit separate to our regular medical offices or our regular facilities. And it might just be down the street or around the block. But the reason being is because our members wanted to have a separate place where they felt safe to seek mental health guidance without the situation of running into somebody they might know at our regular health centers. So just keep an eye out for these new locations. Either they're open or they're opening soon, and you can check them out if they're near you. Next slide. Overall, thank you guys for your time and attention. Today I have shared some tips about seeking care, as well as the many wellness resources offered through Kaiser Permanente and what you can take advantage of to improve your total health. I will be available for questions after this presentation, but I will also make sure to check the chat and see if I can answer any little questions while you're all here. Now, thank you so much, and I'll pass it back to Jessica.
Thank you so much, Gabriella. And now I'd like to introduce Iris Schaeffer, the Field Account Manager for United Healthcare.
Hi, and thank you for your time today. Thank you for taking time to learn about your benefits offered through United Healthcare and your employer. Next slide. Here are the two plans being offered to you by United Healthcare and your employer. An overview of the plans will be provided on the following slides. Next slide. With United Healthcare's Select Plus plan, you get our national network and out-of-network coverage. You can receive care and services from anyone in or out of our network. Providers in our network have agreed to provide services at a contracted rate. Out-of-network providers have no such obligation, which means the services with an out-of-network provider will cost you more. We encourage you to consider choosing a primary care physician who can be your partner in managing your care. Preventive care is covered at 100% in the network. And when it comes to paying for care in network, here are some examples of basic, plan information. The deductible is $250 per person and up to $750 for a family. After you reach the deductible, your co-insurance for a primary care physician visit or specialist visit is just 15% of that contracted rate. And the individual out-of-pocket limit is $3,750, and the family out-of-pocket limit is $7,500. Now, please know that this policy contains exclusions and limitations. For full coverage details, please see the official health plan documents. Next slide. With the Choice Plus plan, you can use any doctor, clinic, hospital, or health facility, but you can save money when you use someone in the national network. You have coverage if you need to go out of network. Just remember that out-of-network providers likely charge you more and can even bill you for amounts higher than what your plan will cover. You don't need to choose a primary care physician or get referrals to see a specialist, but we do suggest you consider having a PCP because they can help in managing your care. Again, with the Choice Plus plan, preventive care is covered at 100% in the network. And when it comes to just network care and, in network and out of network, the structure of the, and costs are the same as the Select Plus plan that we just had on the previous slide. Next slide. You can use one of 3 easy ways to find a primary care physician or determine if the one that you currently use is in our network. The first way is to look for the Find a Doctor button on MyUHC.com. You can also call the number on the back of your health plan ID card, or you can search using the United Healthcare mobile app. Next slide. Upon enrolling, activate your MyUHC.com account to help you manage your benefits and healthcare. Doing so will allow you to find network providers and their locations, check account balances, manage your claims and track expenses. You can even estimate costs for care. You can find and compare medications and even renew, refill, and transfer home delivery prescriptions. Next slide. Now let's take a look at the pharmacy coverage. Next slide. Optimarx is your United Healthcare Plan's Pharmacy Care Services Manager. Optimarx is committed to helping provide you with safer, easier, and lower cost ways to get the medication you need. The United Healthcare Prescription Drug List is the list of commonly prescribed medications covered by the plan. This PDL is organized by cost levels known as tiers. Choosing medications in the lower tiers can save you money. The city plan prescription coverage is as follows: $10 for a tier 1 medication, $25 for a tier 2 medication, and $50 for a tier 3 medication. Next slide. Use network pharmacies and you'll generally pay less out of pocket. Our network includes thousands of pharmacies across the country. Before you go and pick up your prescription, check the medication costs online at MyUHC.com. And when you arrive at the pharmacy, just present your health plan ID card, and the pharmacy will verify your eligibility and also advise you of any out-of-pocket costs that you owe at the point of sale. Next slide. With MyUHC.com and the United Healthcare mobile app, you can enroll in home delivery. You can find network pharmacies, refill prescriptions, set up reminders as well for yourself, estimate and compare medication costs, and you can search your plan's prescription drug list as well. The United Healthcare app can also help determine how a medication is covered and whether or not there are any other options that can help you save money. Next slide. Now let's talk about some additional benefits that are included in these plans. Next slide. You can count on us to help make your healthcare experience easier. We'll give you support designed to help you save time and money and find care when you need it. Help is just a phone call, email, or even a web chat away. Contact us for help with a personal touch. As a member, you can reach us by phone or by logging into myuhc.com and clicking on the call or chat button. We're available Monday through Friday during regular business hours. Next slide. Fertility Solutions Program. It connects you with clinically guided support and education that can help throughout infertility treatment. Next slide. Rally is a digital experience on myuhc.com that's designed to help you make healthy changes to your daily routine, set smart goals, and track your progress. You can get personalized recommendations to help you move more, eat better, and even improve your health, and have fun while doing it. Earn credits for taking healthy actions, connect with people, in a supportive community, and get the support you need to stay motivated. Next slide. Whether you want to lose a lot of weight or just a few extra pounds, Real Appeal is designed to help you with simple steps and support along the way for lasting weight loss. This program includes a personalized transformation coach who can help guide you and customize steps to fit your personal needs and preferences, your medical history, and your personal goals. There's 24/7 online support and a mobile app to help you stay on track and to reach your goals. And there's a personal success kit featuring a personal blender, digital food scale, and more. Next slide. Get access to care online at any time. When you need care, anytime, day or night, virtual visits can be a convenient option. From treating the flu and fevers to caring for migraines and allergies, you can talk to a doctor by phone or video 24/7. Please note that there is a cost for virtual visits, so see your health plan documents for coverage details. Next slide. To learn more, visit us online or give us a call and we'll walk you through everything. Thanks for your time today. I'll hand it back to Jessica now.
Thank you so much, Iris. Now I'd like to share, if you go to each of our health plans microsite, you'll see that on their landing page, there is a way for you to access their office hours, and I've circled it in red here. But we also sent out an email earlier today, with a direct link, so you can access their office hours via that direct link as well. If we go to the next slide. Yay, so we have arrived at our Q&A session, but I just want to give you our address for if there are members who want to mail in their forms or you need to provide documentation. That is our address, 1145 Market Street on the 3rd floor of San Francisco, 94103. And of course, our website, sfhss.org, and of course, our phone number and our operating hours. So now, without further delay, I'd love to open this up for Q&A, and I'm going to look at our published questions. Adam, are you still here?
Yes, I am.
Great. So we have a question. We have a member who wants to go to CPMC, but when she calls CPMC, they do not accept Brown and Tolan Group. So for Blue Shield HMO Access Plus plan, please let her know which medical groups are accepted. That
Which
can
medical
where I
groups
guess
are- Which ones are accepted at CPMC?
I believe so. Yes.
Well, the contract negotiation with CPMC and Brown and Tolan would be in both Trio and Access Plus. So that would cross plans. But CPMC, you could. I'm trying to think offhand which medical groups. You know, I don't want to give out any incorrect information. I would need to pull a listing.
Okay, great. And I will share the she did.
Yeah, I can provide that to you.
Okay, great. She provided her email, and you actually, if you can reach out to Blue Shield for one of the office hours, you can have a one-on-one appointment where they can walk through that with you. I've got another one.
That's actually the best way to do it, yeah, because then she can ask additional questions if needed.
Exactly, great. So I've got another one. Do both Trio and Access Plus both utilize physician organization, Brown and Tolan and Hill's physicians?
Yes, both Hill and Brown and Tolan are in both plans.
I think this one is sort of more informative that there's concern about Brown and Tolan terminating its relationship with CPMC for outpatient issues, including mammograms. And they just want to say that this is very disruptive.
Yes, and we at Blue Shield agree, and we are in constant contact with Brown and Tolan around this issue.
Great, thank you. And I have a question for Kaiser. Gabriella, are you here?
Yes, I am here.
Will Kaiser cover care if we happen to be out of the country or out of the area, out of the network area?
Yes, and I just happened to finish typing that one, but with Kaiser Permanente, you're covered for emergency and urgent care services worldwide. So no matter if it's in California, in the country, or outside of the country, in most cases, it will be a reimbursement process. So get the care you need, and as soon as things are stable, you would submit a claim or connect with your Kaiser Permanente team to begin the reimbursement process. But you will be reimbursed everything except for the cost you would have paid had you gone in network. So it's charged like in network. Aside from that, we heavily recommend or utilize our telehealth services to allow you to get more non-urgent care still with your own Kaiser Permanente physicians. And we partner with minute clinics. So minute clinics around the world, especially, or I'm sorry, in the different states that Kaiser Permanente is not in within the United States, where you could easily walk in or make an appointment with a CVS minute clinic for urgent care services, and you will not have to be, you won't have to be reimbursed for that care. They will charge you as if it were in network. They have a partnership with us, so you can get urgent care and then get a follow-up prescription for that appointment. So you have a few options, but at the end of the day, emergency and urgent care is covered worldwide.
Great, thank you, Gabriella. And now we've got a question. I think this is for all three health plans because there was no health plan specified. How are we supporting same-sex couples who are family planning? For example, in some cases, insurance carriers require diagnosis of infertility before in vitro is covered. Adam, can we start with Blue Shield?
Sure. Yeah, we are currently working on updating the infertility benefit where it will no longer require diagnosis of infertility before you can access the services.
Thank you. And Kaiser, how are you addressing this issue?
So we will always support and offer infertility care as medically necessary with same-sex partners or without same-sex partners. We do have to do a diagnosis first of your fertility percentages or what are your rates or data and how is it going. And then we move forward to bringing up the conversation of what are your options and what's best for your medical situation. But same sex, as long as it's approved and allowed through HR, that's first and foremost all that matters, and we support it either way.
And United Healthcare, Iris, could you answer for United Healthcare?
I just see that it has, it's covered in network, at 85% of the contracted rate. There are certain limitations. Do keep that in mind. Like I think there's something like 6 rounds of one particular kind of service, and then but I think it's very important to just see the plan documents, but it is clearly spelled out in the plan documents that there is coverage in the network and out of network.
I believe that's a 50%.
Yeah, out of network is 50%, and then in network, and that's 50% of the allowed. So, I mean, keep that in mind. And then it's 85% in network, and that's, contract rates.
Oh no, I'm looking at the chart right now. IVF is 50. In network is also 50%.
Oh, okay. I see what you're talking about. So it's 85% just for the diagnostic, evaluation, and then 50% after deductible. Yep, you're correct.
Okay, great. But the question was, how do you require diagnosis of infertility? Or do you, for same-sex, like how are we supporting them?
Oh, okay. So that's a little bit more detailed. I think I'd have to get a little bit more information just to make sure I provide a concise response. I can definitely respond afterward.
Great. So I do want to let you know that we are working with all of our medical plans. We know that this is a concern, and we are working with all of our medical plans to ensure that there's no discriminations. But thank you for that question. We do appreciate that. Adam, back to you. Which medical group refers to UCSF Specialists? I know Hill's Physician does, but I don't know if you know of others.
I know of Hill Physician because that's the largest enrollment in the plan, but I could not say off the top of my head all of the medical groups that refer. That is something I can provide after the call when I can actually pull a listing.
Okay, thank you, Adam. And we have Betty who wants to know about enrolling in WorkTara Benefits. My understanding is it will continue, but we do have some new WorkTara, voluntary benefits. So you may want to see if the new one that's come out actually provides better coverage for you. Because we do have a few like MetLife, I think critical illness and accident insurance has additional benefits and may actually cost less. So I recommend you take a look at that information. And Gabriella, I have another question for you. Did Kaiser hire more mental health professionals to actually meet needs of patients?
Yes, so along with the mental health expansion in the facilities that we've been working on for a few years now, we also increased our staffing by 28%. So we have increased our staffing, and try to continuously enhance and improve our mental health services. But it's something that we're committed to continue to do. It's not something that's going to be fixed overnight. And like I said, we're addressing the shortage as a big medical health provider, but we are still going to improve as the years go by. But yes, short answer.
Okay, and I'm just going to, I think that's all the questions that we have for today. So we will post, so many questions were already answered in our first medical plan webinar. And that Q&A is already online, but there are some new and really great questions here today. We will get those answered shortly, and we will add that to the Q&A that's already online. Thank you, everyone, for joining us. Thank you for asking your awesome questions. We hope you were more informed and can make the elections for your healthcare benefits following this. And if you have any questions, please reach out to either the health plans for their office hours, or you can always reach out to our member services team at the number listed on this page. Thank you so much, everyone, and have a great evening.